Welcome back to Proof or Potion, the health and wellness podcast where we critically evaluate holistic health research to figure out if a trendy lifestyle hack, supplement, or wellness tool is actually supported by science or if it's just viral fairy dust.
That's right. Each week, we break down one human clinical trial or a systematic review or a meta-analysis of multiple trials to help you, the listener, decide whether or not an intervention is proof or potion.
Today, we're diving into a hot topic, ginger for menstrual pain. Can taking oral ginger actually help reduce the severity or duration of primary dysmenorrhea, or is it just a tasty root with a lot of hype?
Yeah, it's one of those remedies that's been floating around both the internet and traditional medicinal circles for centuries. So let's see what the research really tells us. Okay, so Keely, have you ever experienced period pain before?
Yes. And it's been a journey. I mean, I used to have it, especially in my teen years, and I had horrific period pain. It was debilitating to the point where I wanted to knock myself out. It was so severe. And I have not tried ginger for it because I didn't learn about it until I was in naturopathic medical school. But I had I think the biggest, changes for me were increased circulation through adding cardio to my diet, and I eliminated gluten and a lot of grains. And so I no longer suffer from period pain, which is great.
Awesome.
But I have many, many clients, friends, and family members who do. So this is a hot topic. Everybody, is struggling with it. And I'm grateful that, I don't have this problem, but I would love to help people who do. Have you experienced period pain?
Totally, 100%. Still do. I am not in the cured of period pain category. No, I definitely still do. And it's interesting as I kind of age, like how it has changed over the years. And interesting to say when I was a teenager, it was really way worse.
It's horrible.
So
Yeah.
interesting.
That's common for it to start more severe and then for some people, yeah. And there's some other conditions that can make it longer, certain things, but for many people it's worse during those early. There's a lot of hormone fluctuations and things like that that can make it pretty severe.
Yeah. Now I'm not gonna lie, I just reach for an Advil because I do not have the patience or the capacity to handle my period pain. Especially I find I typically have a lot of cramps during nighttime, during sleep time, and I'll actually wake in the middle of the night with pain. So I'm usually like, we're just taking an Advil before bed because I'm not trying to play that game. So
yeah, I appreciate the honesty. I feel like on our holistic health channel, and I know I have a lot of clients like that as well. They're seeking natural alternatives and interventions, but the pain is so severe that they will take whatever they have to not be suffering. And because you still need to be functional.
Yes.
I think that's one of the hardest things is to not miss out on work or school. If it happens every month, you need something that works to eliminate the pain so that you can, survive in your life. So I think this is a really fascinating topic. So, all right, let's set the stage. So primary dysmenorrhea is menstrual pain without any other underlying pelvic disease or issue that can be found. Super common, affects 50 to 90% of young women and teens. Can be severe enough and all ages, premenopause, and can really disrupt school and life.
So the pain is caused by inflammatory compounds called prostaglandins, which are chemical messengers that trigger uterine contractions, and sometimes increased vasopressin, which can reduce blood flow and make the cramps even worse.
And historically, ginger has been used for everything from nausea to digestive upset, colds, and yes, menstrual cramps. Traditional herbal medicine sees it as anti-inflammatory, warming, helping relax muscles, improve circulation, and driving those beneficial compounds deeper into the tissues. It's also what we call a corrigent, meaning it makes other herbs taste better, especially very bitter ones. And if you've ever had ginger, it's like sweet and spicy and really like warming and calming.
So the authors of this particular study wanted to see if ginger could reduce pain severity and duration in primary dysmenorrhea, either compared to placebo or to the standard NSAID treatment.
Exactly. They did both a systematic review and a meta-analysis, slightly different, which means they looked at all the randomized controlled trials in humans they could find with these particular treatment parameters and outcomes, pulled the data together and analyzed it statistically. That's that review plus meta-analysis to see if ginger really works.
So let's dive into the results, right? So the systematic review and meta-analysis by Rigi et al. Looked at 8 randomized controlled trials between 2008 and 2020 of college-aged participants. So keep in mind, this is not necessarily generalized to older premenopausal women.
For treatment, participants took oral ginger root powder capsules with between 500 and 1600 milligrams per day, or 1.6 grams, depending on the study. So they were taking anywhere from 250 milligrams twice per day to 400 milligrams 4 times per day, with the most common dose being 250 milligrams 4 times daily. This was for the first 2 to 3 days of menstruation. One study continued until the pain had resolved, so it could be longer. The studies looked at treatment for an average of 2 to 3 cycles and averaged the results of those 2 to 3 cycles for pain scores. 5 studies didn't disclose the origin or constituents within the ginger powder, and one didn't include the product origin or the dose or frequency at all. At least 4 studies out of the 8 used less than 1 gram total per day, and anecdotal clinical reports and broader research on similar studies suggest 1 to 3 grams daily is considered therapeutic.
As for the controls, 4 of the studies used a placebo capsule, and 2 studies compared ginger to over the counter NSAIDs like ibuprofen or prescription NSAIDs for period pain like mefenamic acid. Participants were randomized, and most trials were double blinded, though a few had unclear methods or a higher risk of bias in blinding or allocation. Pretty common.
Yeah. They measured outcomes mainly with a visual analog scale, or VAS, for pain severity. So it's a 0 to 10 scale, and recorded pain in hours or days. Most menstrual pain studies look at just the severity. So duration was an interesting additional outcome in this study that they analyzed. Secondary outcomes they looked at were, did it change bleeding at all, and changes in satisfaction rates.
Okay, so what did they find? Did the ginger capsules help with period pain? After evaluating 7 of the 8 studies in the final meta analysis, one study didn't have enough data to be included. Statistically, ginger significantly reduced pain severity compared to placebo, with a mean difference of about 3 points on the VAS scale. So, if a participant had reported a 7 out of 10 on average period pain before taking the ginger, they would then report an average of 3 out of 10 after taking the ginger over the course of 2 to 3 cycles. And here's the really interesting part. Compared to NSAIDs, ginger was equally effective in reducing pain severity.
Wow. So
Wow.
that's really exciting, especially the part about comparing it to over the counter pain meds. That's such a cool comparison. In somewhat less exciting news, the ginger didn't consistently reduce pain duration compared to placebo. So if you had been suffering for 3 or 4 days of period pain per month, that aspect would stay the same. And it didn't completely eliminate the pain to zero. Even the lowest VAS scores or pain scores were around 2 to 3 out of 10. But we're still talking a decent drop from moderate to severe scores down to mild to moderate, which can mean someone maybe has the ability to go to work or school and function when they would otherwise be debilitated from moderate to severe pain. So when you have a period every month and you only get a break for 3 to 4 weeks in between for 30 plus years of your life, that's a lot of pain and suffering and not being able to function. So for some women, so
Most definitely is. Any side effects reported were mild, usually heartburn or headaches. So I think we can say that ginger is pretty accessible. It's not terribly expensive and is generally safe according to these studies. But we're going to go ahead and discuss the safety considerations a little bit more later. It did show meaningful pain reduction in these studies and could be an alternative for people wanting to avoid NSAIDs if they're concerned about like the GI upset, the ulcers, or other side effects that are commonly known with NSAIDs.
cons were definitely sample size. There were only 70 to 200 participants total per study. So 30 to 100 people receiving the ginger capsules. They were all, of course, teen to college age women, which we mentioned. High heterogeneity, which means a lot of differences in like the product type used or unknown sourcing, the different doses, times per day. Were people taking them 4 times per day is kind of a lot to expect of people. And without contacting the authors to get information on the products, it's hard to replicate that. One study was missing dosing info completely, so not a lot we can tell from that. And a lot of them were under that 1 gram per day threshold. That's kind of that therapeutic dose consideration. So
All right. So, what's your take? Does ginger reduce period pain?
I think it's promising for sure. I mean, it's definitely the part about it being as effective as NSAIDs. I think if you've ever taken ibuprofen or Aleve or some of these things for period pain, you know it can work. And that says, and those are strong anti-inflammatories. I think it does suggest there's this strong anti-inflammatory component, which is exciting. The duration, I wouldn't necessarily expect a huge change there.
Yeah.
And of course, there's things like the scale where it can be hard to evaluate pain sensation.
Right.
So whenever a study only has that subjective component,
Yeah.
0 to 10, I know if a doctor ever asks you that, most people look at me like an alien when I ask them to give me a pain score because they say, I don't know if it's a 2 or a 5 or a 3. What does that mean to you? But you always have to wonder, like, if it's only like a couple months of data on a visual pain score, it would be nice to have something a little more objective or maybe have it over 6 months. But either way, when we're comparing to NSAIDs and when we're seeing that average drop in that many participants, I do think that there is some significant data there. What do you think?
Yeah, I mean, it's promising. I'm a skeptic because I do reach for my Advil, right? Because I know it's going to work. I am a little sad that the ginger doesn't reduce it to 0, but to me, like my naturopath brain goes to like, well, we're not addressing the root cause ultimately, right? Like, what is our root cause of our pain? If we can address that, then the ginger can maybe be even more effective, right?
Yeah.
And honestly, Advil doesn't always take it down to 0 as well.
I was going to ask.
So it's
Yeah,
not really a fair thing, right? Like, I guess maybe in my head, sometimes I'm like, yes, it took it to 0. Other times it takes it down to a 1 or 2. So very comparable for ginger. So now I'm curious. I will have to try. I'll have to give it a try.
And dose wise too. So, depending on the dose of Advil that you're taking, because in a lot of these studies, it was a typical 250 milligrams 3 times a day or whatever. So, I know some clients who rely on way higher than that in terms of dosing to get to 0 or to get to a manageable level. And I think sometimes our brains, at least for me, I think the drug is going to have a more significant effect. It's just there. It's programmed to think that way. Like, I don't know if the natural will work. And certainly if you're just drinking ginger tea, that's probably the
Not
case,
gonna do it.
right?
Yeah,
Probably not getting that high enough dose, but maybe there is a subtle benefit. And maybe if some of those other, changes are made that work for your body and you figure that out, then, in that hormonal balance or whatever it is that's part of the cause, maybe it can have a stronger effect. And I thought that was super interesting with the dose in these studies too. It makes it really difficult when some are at 500. So I do think it's interesting that maybe if they were a little bit higher in therapeutic dosing, maybe we would see even stronger and maybe we could get it closer to 0. Also, they didn't talk about the side effects. They had that secondary outcome where they were supposed to look at if it affected bleeding and satisfaction rates. And those have been really interesting. They didn't report on them because they didn't have enough information.
Right.
And so that tells me that the authors didn't include it. And then you have to ask why it wasn't included. And it could have been that it just didn't happen. And so it wasn't that important. Or it could be that it did happen and they didn't want to report it. So
And bleeding is a risk with ginger. Is that correct?
yes, it's the most important risk in my opinion. Yes, heartburn, it can be burny, especially if you take it longer term. It can add up over time because some people will take it for other purposes.
Right.
If you have chronic pain, things like that, people might be taking ginger by itself or in a blend, and you do have to think about that burning because it's very warming, very stimulating.
So it could increase menstrual bleeding.
Yeah.
Yeah. So like that, there's a
In
little
this
bit of a
case-
balance here, right? Like,
Yeah.
which is why I think that they had them take it like that first couple days to hopefully not get the effect of changing bleeds.
I think they took it at the beginning to reduce because that's when the pain is the worst for most people.
Okay.
Is that day before to that first 1 to 2 days, and they mentioned that too. Does it help with duration? And I did see one other study that we're not talking about today, but it had said that if you take it pre, a day or two before, that it might have even better effect for pain because you're hitting it early, which is the case with a lot of pain. If you kind of stop that or you like support the circulation, stop that inflammatory cycle, which some people track their cycles and know, can do it in advance and some people can't. So there's that aspect of how are we, tracking the cycle, but do we know if we can prepare for it? But yeah, if you can hit it early, that might help. But yeah, there is the risk of bleeding. And that's true too for other things like surgery or if you're on blood thinners, there's or other supplements or medications can have additive effects. And so that's also with the higher dosing, something to consider people think natural things are safe and it's just ginger, but these things do come with risks, especially when you increase them to a therapeutic dose
Yeah.
and aren't just, using some ginger powder in a recipe or, you drinking a ginger tea, which is a lot lower in potency once you're grinding the powder and extracting it or having capsules and, 1 to 3 grams a day, we do start to see some of these side effects or risk potential. And so I wish they would have been a little clearer about that in those studies, so that we had a little bit more information, particularly when they're testing it on bleeding in particular, right? That would have been really helpful, but we got the data that we got. And all right. So what do we think?
So what do you think? Proof or potion?
I think there's some pretty good proof in this one.
Okay.
How about you?
Cool. I'm proof
Are
skeptic.
you going to try it?
I'm going to try it. I feel like I'm not going to like truly accept that it's proof until I feel like it works for me.
We'll do a follow-up.
Yeah.
Morgan's journey, trying ginger for period pain, and let you know how it goes.
Yes, for sure. All right.
And study of one.
Case study of one. That will be a great trial. But we'd love to hear what you say.
Yes. What do you think?
Proof or potion makes sense for you?
Any experience with it? Any other studies?
Yeah.
What do you think? We want to hear from you. So, of course, like, subscribe, comment, let us know. We'd love to hear from you, and we will see you next week.
Thanks for sticking around with us.